I think we need to expand the discussion beyond just employers making investments and the dividend happening for the employers. It also needs to be at the individual level. Those that invest their time and energy around better health, what's in it for them and what dividend can be there for them. And I think as we bring those together, the employer and the individual consumer and both making investments, the dividend is going to be expanded for everyone involved. Our employers work with us, and we put together a different type of financing framework, one that we call individual behavior financing or individual behavior underwriting. And what that does is it allows individuals who engage around their health have an opportunity to pay less for their health coverage because they're impacting the cost of those health care coverages down the line. What we need to do is have a system, we call it a health system, to support every aspect of that. Not only change in financing, but also what are the tools, resources, and information those individuals need in order to be successful. And that's what we've put together. When we think about going forward, where can we have the maximum dividend? It's really it's embodied in the individual in terms of the individual represents half of healthcare costs and the choices they make prior to any point of care: smoking, exercise, nutrition, and preventive care. So how can the employer partner with that individual, allow them to also benefit in the dividend, is where the big opportunity is going forward. The opportunity is to say, how do we get after those half of healthcare costs that are avoidable in the individual's control? And can we actually change and have a different financing mechanism? And if you get rid of that, take half of the costs out of the equation, you all of a sudden have a very affordable health product for individuals, and that's the opportunity that we have in front of us. I think the bigger opportunity is around the engagement, frankly, in terms of if we can actually get people engaged around the health and the health status that they can control, we can actually reverse costs and begin to see decrease in total costs. And so the opportunity is, how do we get employees to embrace that and own their own health, share in the dividend for those that do, and have this self-sustaining over time where they want to continue to make investments of time and energy around their health and improve that status. About 96% of the dollars that we spend to try to cure all the ills in healthcare are going to point of care or beyond. Clinical setting, how do we deliver it more efficiently, care management, network discounts, go down the list. We spent 96% of the dollars we spend in healthcare all around that. We spent 4% of the dollars on the 50% of healthcare costs that are impacted by people's decisions prior to needing any point of care. We must go upstream and look at how do we invest for a better dividend on decisions that are made prior to point of care. And if better decisions are made, they're never going to need that point of care and costs are going to begin to come down. We're at an interesting time right now in terms of where things are likely to go. We know that there's going to continue to likely be a mandate, and actually more of a mandate, for employers to participate in investing in health, required by the government most likely. And when you think about that and you move down, the government is also going to say, if you don't play, here's how much you have to pay. It's interesting, they're almost looking at putting on the table what the dollar amount is for a defined contribution when you step back and look at it. And when you look at where we are today, I would argue we actually have defined contribution right now. We have reactive and unfair defined contribution, in that we wait and to see what trend is going to be. We work and do everything we can to minimize it. But we get an idea and we come in and we say it's going to be 7%, and usually it's HR going to CFO, and the CFO says all we can afford is 3%. That your defined contribution is 3%. The implication of the 7 versus the 3 are now peanut butter spread across the entire population, whether or not the employee was engaged around their health or not. And so our opportunity and challenge is how do we have a more fair way to distribute those costs in a defined contribution environment.